no conflicts of interest to declare. We will have to think about what menopause is all about. The definition of menopause. In the case of doctors who look after breast cancer patients, menopause might mean something different with menopause in healthy women. Because menopause in healthy women, if you look at the definition given by the dictionary, it is something that happens gradually, usually beginning at around the age of 50. And this is something. It's a duration. It's a time during which a woman gradually stops menstruating, and the mean age being 51 years, and 95% of women reaching menopause between the age of 45 and 55 years. This breast cancer specialist, for those doctors, menopause has a different aspect to it. In the absence of chemotherapy, for instance, if you look at the definition and the guidelines, what the guidelines say, no menses for 1 year in the absence of prior chemotherapy, or no menses after surgical removal of all ovarian tissue, is what doctors refer to as menopause in patients with breast cancer. So the menopause in healthy women, the definition, and the definition of menopause in patients with breast cancer might be a little different. So there is this subtle difference of nuance between these two groups of women. And if you look at patients in Korea, we said that this begins usually during the years of 45 years old and 55 years old. But if you look at the patients in Korea, one of the characteristics that you can see in Asia, we see a cluster. We see a high incidence of breast cancer in younger population. When you treat these patients, we would resort to surgery or radiotherapy. They fall under the category of local control. So we're trying to attack the cancer cells surrounding that local area of cancer. But if you use a systemic therapy or pharmacotherapy, whether it be chemotherapy or targeted therapy or endocrine therapy, they have to do with your total system, the whole body, and especially anti-hormonal therapy and chemotherapy will lead to a damage of ovaries. So from that point on, there will be a stop. The menstruation will be stopped, and because of the administration of chemotherapy, menopausal symptoms can be induced. And after the chemotherapy is over, you would usually move on to anti-hormonal therapy. And for people who are already postmenopausal, some people are under HRT for osteoporosis or other symptoms. But once you are diagnosed with breast cancer, you have to stop using hormone replacement therapy. So hormone replacement therapy was working somewhat in your body, and then you have to stop the administration of these agents the moment that you are diagnosed with breast cancer. And in premenopausal women or in perimenopausal women, chemotherapy or anti-hormonal therapy, in 33 to 73% of the patients, in other words, 1/3 or 2/3 of patients would move on to a menopausal state. So after chemotherapy, some people will involve. So after the chemotherapy, after some amount of time, the ovaries will recover somewhat, and sometimes you will think that the ovaries are functioning well, and so you will have to suppress that. So ovarian suppression status by endocrine therapy will be administered. So this is something that a lot of people, a lot of patients will suffer from. And as a result, so this is something that will sooner or later, all of the patients will have to go through this because of the stopping your HRT because of chemotherapy, because of endocrine therapy. At one moment in time, you are likely to experience one of these or all of these. And so this is something that's for the recurrence of cancer. This is a research that we just conduct for such possibilities. But nevertheless, patients are still suffering from the symptoms emanating from the administration or the stopping the administration of some agents. And if you are to divide the different symptoms, the hormone-related symptoms, these are the questions that we usually ask our patients. Have you been bothered by hot flashes or night sweats? And in the absence of in the absence of HRT, women can experience vaginal dryness and or urinary infections or vaginal infections. A lot of people suffer those conditions. And also a change in sexual function. So do you have any concerns regarding sexual function? And apart from this, something that a lot of women suffer from has to do with a sleep disorder, frequent awakening during the night or having difficulty going to sleep, for instance. So these symptoms have a link to the chemotherapy that breast cancer patients receive. And these symptoms are very common, and they frequently occur in our patient group. For instance, hot flashes, night sweats, or vaginal dryness, and the sexual dysfunction, or urogenital complaints, or discomfort, or sleep disturbance, and arthralgia or myalgia induced by pharmacologics, pharmacoagents and fatigue, and mood disturbance and depression, sometimes cognitive dysfunction. All of these symptoms have to do with menopause. And I think our next speaker will give a talk on just this topic. And I will be brief with each of these points. So the hot flashes is something that's most common in menopausal women. Hot flashes and night sweats, these symptoms do not appear just overnight. This is something that will appear within 5 to 10 years period. So the body will adapt gradually. But if these symptoms just appear overnight, that's when patients experience difficulty adapting to the new situation. And so usually these symptoms would go away by administering HRP or hormone replacement therapy. But what about the case of patients with breast cancer? Can they still get HRT? But we need data to prescribe something to our patients, and there is a study on just that. So in the breast cancer patients with the severe symptoms, administering HRT gradually and looking at the results. And what 3.3 means here means that in the test group, the recurrence rate would be increased by threefold. So we cannot resort to HRT because of this. And in some instances, I think you have heard a lot of times that this is not a hormone per se, but this has the same effect of HRT. So we try to test this with Tivolol, which is known to have a lower effect on the breast. And so we looked at the results. So how to read this? What's on top means it's bad. So in the blue group, it's the placebo group, and in red we have the test group. So we can see that the results, the negative results are visible. So this test had to be stopped. And so HRT and HRT-like agents cannot be used in those patients, in breast cancer patients. So next, what can we do then? First, non-pharmacological management, because breast cancer patients already take a great amount of medication, so it's good if they can do away without with medication. And the second, a non-hormonal pharmacological management. And third, resorting to other options, such as dietary supplements or food. So for non-pharmacological management, the most recommended item is losing weight. So if you lose weight, most of these symptoms will be improved as a result of this study. So it's not just a little weight loss, but it's at least 10% of your total body weight. So for instance, if you weigh 60 kilos now, which means that in order to resolve these issues like hot flashes or night sweats, you have to at least lose 6 kilos. And so this is a study based on the Western population. So if you apply this to the Korean population, I don't think the Korean women are this obese or this big. So this weight reduction by 10% of total body weight, and this is something that you will really have to discuss with your doctor. The second point is a lifestyle modification. What can we do? Maybe it's too simplistic, you might say, but since we have hot flashes, you might want to lower the room temperature. As simple as that. And we have handheld fans nowadays. So you can use portable fans to lower the temperature of your face. And also wearing cotton garments. And layered clothing may be recommended. So if you feel warm, you might want to remove one or more of your clothes. And subsequently wear more if you think you're getting cold. And also, there are some circumstances that would induce hot flashes. For instance, when there is a spicy food intake, or there is a stressful, and that will lead to a very frustrating situation. So you might stop taking spicy foods in front of other people, or limiting intake of alcohol. So this is avoiding triggers. So you might want to avoid these trigger situations. And also, under all circumstances, you have to quit smoking. For exercise and physical activity, there are a lot of documents and research. Some say that they are useful, some say that they're not. At least they're not bad for you. So when in doubt, it's better to do exercise and yoga or aerobic exercises than not doing them. Some were more effective than others, but nevertheless, weight control and lifestyle modifications or exercise, not only to resolve these symptoms, but these are very important for all breast cancer patients. So you might want to try them. And also, integrative therapies for cognitive or behavioral strategy. And here we have a bullet point on acupuncture or Chinese medicine as opposed to Western medicine. But I'm very cautious when it comes to talking about acupuncture. But according to test results, there are some studies that suggest that acupuncture may be helpful. Acupuncture are looking at the pressure points, but this study deals with using acupuncture in all parts of the body. So we don't have a very clear-cut conclusion of these studies yet. And next, we can think about non-hormonal pharmacological management, which is resorting to medication. What is recommended most are antidepressants, but we have to be careful because I'm sure that a number of you use tamoxifen. In the treatment of breast cancer, the pill itself is not effective, but that has to be absorbed by the body, and it will be transformed. And that's where the effect takes place. And among the antidepressants, there are agents that block this mechanism, so you have to be careful of the drug-drug interaction. And if those agents suppress the effects of your breast cancer drugs, so you will have to avoid taking them. So if you look at the results, among the antidepressants, for tamoxifen administered patients, and this is venlafaxine is recommended because it does not have a direct effect on what you are taking. So you don't have to worry about this. But so, for instance, if you feel blue or down, and if you discuss this with your doctor, so your prescribing doctor who treats your breast cancer, I think he will be already well versed. But if you seek advice from another doctor, from psychiatry, for instance, you will have to give that doctor all of the relevant information so that the doctor can make a right choice in prescribing the right medication for you. And only then will be the doctor in psychiatry, for instance, will know which medication to prescribe and know that you are a breast cancer patient. And we also have gabapentin, like those anti-convulsants. So gabapentin will allow you to reduce the frequency of hot flashes and the severity of hot flashes. But the problem is, when you take a drug, you have to think about the adverse effects or events of a drug. So drugs are effective and efficacious, but there are also adverse effects and side effects of drugs, so you'll have to consult this with your doctor. And also, as another option, sometimes patients come and tell us that they are phytoestrogens and they come from a botanical source. And for doctors to say okay to those questions, we have to have evidence, but we don't have evidence as of yet for these agents or these items. So these agents will fall under the category of dietary supplements. So we do not recommend you to take these to alleviate menopausal symptoms. So efficacy or safety data are not secured to date. So this is what I tell my patients. So if you really want to take them, please go ahead, but you have to look for the label, and if it says that it alleviates or relieves the menopausal symptoms, do not take it. That's what I tell my patients. So we have looked at the 3 different groups of management types. For the non-pharmacological management, for instance, exercise, stopping smoking, stopping alcohol, healthy diet, weight loss, all of these are very important in any case. So just try out these options. And for non-hormonal pharmacological management, please discuss this with your doctor. And for the others, we don't have any concrete data as of yet. And when there are symptoms like vaginal dryness, these are what we would recommend in theory, but in Korea, a gel is the only option that we can readily use. Because the other options are still not that solid in terms of evidence we can rely on to recommend to our patients. All of these are sold in pharmacies. And if you ask for a gel, you will have to make sure that those gels do not contain hormonal sources. And also, sleeping disorder is one of the major symptoms that women are suffering from. And if you can't sleep well, you will suffer during the entire day. And you will have to find out the reason for that sleep disorder, because it can have another source, such as a psychological problem or a condition, physical condition, or thyroid dysfunction. Maybe this does not has to do directly with menopausal symptoms. In that case, you will have to solve that problem from a different angle. Nevertheless, you will have to maintain a regular bedtime and a regular wake time every day, and you will have to avoid moderate to strenuous physical activity within 3 hours of bedtime. But in a nutshell, what these bullet points mean to say is like during the day, act as if it's a day, and during the nighttime, act as if it were night. So do not do any exercise or drink coffee during the night, or enjoy computer games during the night. So that's something to avoid. So those activities should be done during the daytime. So if you check all of these items, and if you comply with these items, in some instances, you will find a better sleep pattern. And also, especially, because you can't go to sleep, some people would enjoy 1 glass of alcohol before going to sleep, but it will help you. It will avoid you from getting quality sleep. Or you will have to wake often to go to the toilet. So you will have to limit fluid consumption some hours before bedtime. And also for medication, Arimidex or Femada for arthralgia or myalgia. In the case of arthralgia or myalgia, these agents will worsen the symptoms of arthritis. If you think that you will have to stop that medication because the symptoms are worsening, you will have to consult with your physician. So there is no magic recipe to this. You will have to attack all of these different items. And so despite the fact that you have deployed a lot of efforts in these different items, you might want to seek treatment, other treatment. There are different stages of hormone replacement therapy or anti-hormonal therapy. So you might want to allow some amount of hormone circulating in your body. So you might want to change your regimen. For instance, Jolawix or morphine, those injectables. If the symptoms worsen to the point that you might want to change your regimen, for instance, you might just leave tamoxifen and leave the others, or aromatase inhibitor plus GnRH agonist. For instance, you might want to stop that and just leave tamoxifen. So your doctor can fine-tune and adjust the administration of these agents according to your symptoms and also according to the risk of recurrence. And so you will have to balance the benefit and the risk for recurrence. So some instances you would just get the medication and then just not use the medication and throw it away. But rather than doing that, you will have to be frank with your doctor and get something that you will actually take. This is the end of my presentation. Thank you.